Greetings to one and all. On behalf of the St. Elijah Nobel Fest, I, Prashant Jamwal, welcome you to this one-of-its-kind session where we would like to discuss how technologies are impacting our healthcare systems. Chairing this session, I would like to introduce myself first. I'm an academic working with the Nazarbayev University in Kazakhstan. I was graduated from IIT in India with first rank and then did my PhD from University of Auckland in New Zealand. For past more than 15 years, I've been actually conducting research in medical robotics and data analytics. And recently, using a very prestigious World Bank grant, I was able to launch a startup company together with my PhD student, Dr. Vivek. So one of our robots developed through this company was acknowledged as one of the 20 best innovations by the United Nations. So we were invited there and felicitated. So this robot actually was meant for stroke survivors to regain their lost motions and strengths. And so in doing so, the robot that we developed, it understands human capabilities and challenges the patient because eventually the patient has to exert more to get, recovered or reinstated their functions. So what our robot does is, using, of course, brain sensors, it would understand the capabilities of the patient and would support as and when required and would sometimes help and sometimes challenge. So that was one innovation. We do other projects as well there, such as we working in surgical robotics, rehabilitation robotics. We do breast cancer detection using mammographs. Recently, we developed a small software patch for Tagos Molecular Pathology Lab in Germany to help find CPS. It's like a combined positive scores for PD-L1 detection in head and neck carcinoma slides. So that's all there. But we all here today to discuss and evaluate, technological impacts on healthcare globally. And my opinion, first we have science which manifests into technology, and then this technology further manifests into physical systems and systems in silico. So physical systems mean medical equipment and devices. And when I'm saying manifestation in silico systems, and these are data analytics, or sometimes they call it medical information systems. So, but in recent past, we've been witnessing a fusion of these two manifestations into one, and that we see in the form of embedded systems. And I'm sure everyone have heard about this Internet of Things. And so in medicine, we call it Internet of Medical Things, which is, of course, a connected infrastructure of medical devices, software applications, health systems, services, everything put together. The goal eventually is to deliver precision medicine, which might be really possible. But tonight, ladies and gentlemen, we will discuss something beyond all of this, which is extraordinary, something like a sci-fi movie. We shall witness today how human limitations can be surpassed and technological bottlenecks can be removed, rather exceeded. So together with me, I have two eminent personalities tonight who are the most eligible ones to speak about the way technological advancements are impacting the healthcare industry in its entirety. The two pioneers of cybernetics and AI with us tonight are Professor Kevin Warwick from UK and Mr. Vivek Wadhwa from US. Please allow me to introduce Mr. Wadhwa first, who is a distinguished fellow at Harvard Law School, a legendary author from East to West. He's been a globally syndicated columnist for the Washington Post and held appointments at universities of repute like Carnegie Mellon, Duke University, Stanford Law School. Mr. Wadhwa is based in Silicon Valley and he's doing research and he's speaking about and writing columns on advancing technologies that are transforming our world. So before I move on to Professor Kevin, I would like to finish my part with Mr. Wadhwa first. So I would like to request Mr. Wadhwa to talk about, these technological advancements, especially, referring to maybe genomic research. I've heard about you mentioned once Harvard's this organ on a chip project. All these with regard to this personalized or precision medicine. Later in your speech, you might also tell us about this, this affordable diagnostic you were talking about, affordable diagnostic at home. So it'll be interesting if you can elaborate as like what's so exciting about this project. And I remember you are also involved in this famous project called Startup Chile. So if you've come across an interesting project, it'll be worth listening to you. Over to you, Mr. Wadhwa.
Prashant, let me start by giving you a synopsis of what technology is. This device that I have, my smartphone, it's more powerful than 50 great supercomputers. If you go back 30, 40 years, you could not export those computers to even Russia. I mean, forget about Kazakhstan and forget about Central Asia. You couldn't take it even to India or most countries. There were export controls on it. Now you can walk across borders with 50 supercomputers in your pocket. It's advancing exponentially. It's not only computing; it is many technologies that are advancing exponentially. Everything that computing touches, artificial intelligence, networks, sensors, robotics. Some of the technologies you've been involved with, they're all advancing exponentially. The results of it, you're beginning to see now with the current situation. We're all locked in. I mean, I'm stuck in Silicon Valley, and you're stuck in Kazakhstan. I mean, in the United Kingdom, it's getting worse. So first of all, we have a pandemic, which might be the result of genetic experiments, or it might not be. The fact is that whether this pandemic was engineered or not, the next one could be engineered because we have the technology to do it. And the good news is that within the next few weeks, we will likely have many vaccines on the market, which start hitting the market, which can prevent us from getting COVID-19. The first, it used to be that it would take decades to build vaccines. Then it was years. And even when COVID-19 happened, there were arguments that we will not have a vaccine for 5 years. But within 62 days, Moderna and their partners developed a solution, and now they're testing it. So we were able to rapidly use artificial intelligence, genetics, sensors, and a lot of these new technologies to develop a vaccine. And now the delay is in testing it. That's a different discussion. But the fact is that with the data we're gathering now, we will have the ability to cure disease itself. I believe, for example, that cancer can be cured. What we're lacking right now is enough data on the tumors. We're lacking enough data on the type of treatments and what their efficacies are. We're lacking enough data on the reactions between the cells and the type of drugs that we use. Once we get those data, we can apply the same techniques to it, and we'll be able to cure cancer and cure other diseases. You talked about organ on a chip. Why is that relevant here? Because I talked about the delay being in testing. So we're still primitively, testing it on humans, small patches of humans, then medium batches of humans, and large batches of humans. Imagine if we could simulate the testing the same way we simulated the production of the vaccine, using artificial intelligence, using sensors, using some of these new chip technologies. Harvard Weiss Institute, for example, is leading the world right now in developing organs on a chip. There are several, and right now when you're testing for cancers, there are labs all over the world that can create 3D organoids, three-dimensional images of the tumor, and then test treatments on that. Well, what if we could now test vaccines and test other drugs on 3D representations of the body as well? These technologies are also advancing exponentially. So even though we're suffering right now, we're locked in, the good news is that this pandemic accelerated the progress of technology to the point that we will break all the rules now and come up with new methods of controlling this pandemic and then curing this disease and then curing every other disease. This is what's possible. You asked about the project I'm doing in New Delhi. One of the biggest problems here in the West is that medical care is extremely expensive. In the East, you can't get it. In the West, when you can get it, it's extremely expensive. It's, it costs 5 or 10 times what it should. And one of the biggest problems is that we don't get diagnosed in time. So for me to get an appointment with a doctor sometimes takes weeks. And then when I go to the doctor, I have to fill out medical forms, and extremely expensive. I mean, in the UK, you're lucky that you have public medicine so that you can afford treatments. Here in the United States, People die because they can't afford treatment, so they go bankrupt because of all the bills that they get. Well, what if you could be diagnosed immediately? There's a company in New Delhi that I'm advising called HealthCube, which has developed a medical device that I have at home on which you can do your own tests. I can do my own 12-lead EKGs. I can do my own blood tests, my own urine tests. Even for COVID, I have antibody tests that I can do my own antibody tests at home on this device. What does the device cost? The cost is less than $1,000. It retails for $1,700 in India. And the newer versions that the company is planning on will cost $200. So imagine now if you could have devices at home on which you can diagnose your health. And then rather than having to go to the doctor and fill out forms and we do the things we do here, if I could see a doctor in Central Asia, or I could see a doctor in the United Kingdom or New Delhi, and simply share all of my medical data with them and have them prescribe medications the way we're talking right now. This is possible today. This is what I'm working on, in fact. Already millions of people in India have benefited from this technology. So we're now taking this global. This is what technology makes possible for us to now rapidly transform the healthcare system.
Yeah, very well put on everything together. This is what the current state of the art that you mentioned. But talking about futuristic, I know you like to talk about the concept of this microbiome.
Right.
What is this all about? Like, how is it related with the Indian School of Medicine, Ayurveda, and all?
Yeah, one of the flaws of the Western medical system is that it's all based on symptoms. That you get a fever, therefore you try to suppress the fever. You have a pain somewhere, therefore you suppress that pain. Okay, this is what the medical system is based on. If you look at the Eastern sciences, whether it be Ayurveda, whether it be acupuncture, whether there are a lot of alternative systems, they look at the whole body. And Western science over the last 2 decades has actually been researching another branch of medicine called the microbiome, the bacteria in our gut. And what research study after research study is showing is that it may actually be the bacteria in our gut that control disease. I talked about cancer. Well, there have been several research papers published in the most prestigious publications which showed that the microbiome, the bacteria, can turn genes on and off. It could well be that even cancer is being caused by the microbiome, by the bacteria in our gut. So the research on the microbiome is shattering all the concepts of Western medicine because, again, it shows that we're a whole, that there's an ecosystem within us which regulates the body. There's not enough data on this. There's not enough science on this yet. But move forward 5 years when we have all of that. It will change the entire system because we will begin to realize that the treatments might be more effective if by regulating the gut. You asked about Ayurveda, the Indian ancient system of medicine. What's Ayurveda based on? It's on regulating the gut, really on adapting to the microbiome and looking at the body from a holistic point of view, adjusting your food intake, adjusting what you eat and adjusting your life habits, and that's how you treat disease. So over the next 5 or 10 years, I see Western technologies and Eastern technologies converging because we now start looking at the entire human ecosystem as a whole and developing more sensible solutions for our health.
So we have high hopes for that because, ancient Indians, they used to say that we should live for 100 years. So the technology will help us to do so. And thank you very much for your, enlightening comments on these very relevant topics in healthcare technologies. Friends, next, I'm going to introduce to you.
Prashant, before you do that, I have to apologize. Prashant, I have to apologize. I have to sign off because I have a hard stop and this conference is running late. But, I hope you won't mind.
We completely understand. Right. And since the session was delayed, I really apologize for that. But your presence was more than a mark and we would really remember this for long. Thank you so much for staying with us.
Thank you.
Thank you. So, ladies and gentlemen, let me introduce the other guest with us tonight, who has used his mind to control a robotic hand. He has sent his thoughts across the Atlantic and moved a robotic hand. And he has even felt signals from his wife's nerves. in his own neurons. Well, we all do that, but he did this electronically, and that makes him great. Pioneer of cybernetics, Kevin Warwick is Professor Emeritus at Reading and Coventry Universities. His research areas are artificial intelligence, biomedical systems, robotics, and cyborgs. Few of his research achievements are in designing the next generation deep brain stimulation for the treatment of Parkinson's, understanding patterns of electrical activity in biological neural networks, and then controlling robots with that understanding. He's mentioned in the Guinness Book of Records for training a robot in US, but another robot sitting in UK. So, well, among all these very interesting projects, I guess, Professor Kevin, the cyborg project is more interesting and is more valued to you. And tonight, we would get to hear more about this from Professor Warwick himself. So maybe you'd like to throw some light on your interesting project.
Yeah, thank you very much, Prashant, for the introduction. And it's great to hear Vivek's presentation. Some of what I've got to say relates to it. But healthcare generally at the moment is looking at the human body as it is and trying to make it well again when there's a problem with it. But of course, what technology also does is allow us to change what we mean by the body. Now, Vivek mentioned things like artificial organs or organ on a chip, where you're actually developing a different body part. And clearly, there's a whole range of artificial body parts that technology is able to produce at the present time. And also present-day technology. Again, Vivek mentioning telemedicine, so that the doctor can be in one place and the patient can be in another. And this is to healthcare as we know now-ish, with a slight change to it. But I think what I've been mostly interested in is looking at technology that we have now that changes what we think of the body. One of the projects you mentioned involves brain stimulation. This is putting electrodes deep into the human brain to apply electrical pulses to overcome the effects of Parkinson's disease, or even somebody who's clinically depressed can get rid of the depression. What we've been doing is not just applying electrical pulses to the brain, but using the electrodes in the brain to monitor the electrical activity, effectively getting to understand what's going on in the brain much more using artificial intelligence. Effectively, the artificial intelligence is modeling parts of the human brain so that we can then predict what's going to happen in the brain, what can be up to things like 20 seconds before it actually happens, before the person knows themselves what's happening. AI can predict this is what is going to happen in the brain, not just to do with Parkinson's disease, but all sorts of issues in the brain. So I think understanding what's going on in the body, not just in what we're doing there, but in terms of wearables, and I think in terms of sensors, we've got a whole range of sensors now that can be applied to the body, inside the body, that you can be walking around and different readings in terms of fluid flow, temperature, pressure, etc. The state of your body can be given out in real time and monitored separately, so that if you're doing something not well, or you could do it more, it could be good for sportsmen, but it's very, very good for healthcare, particularly remote healthcare. But the experiments, the cyborg experiments, which you mentioned, I've got a little thing here. Now, this is where technology can help. Potentially, if you're looking at some problem and overcoming a problem, somebody who's lost a hand potentially could be given a robot hand of this type to replace their ordinary hand. This hand, which is typical commercial product, is just operated from motor signals, possibly in terms of muscle signals rather than signals directly from your brain. It doesn't have any sensors on the fingertips, which clearly our fingers do. Now, for the experiment that I carried out, I had 100 electrodes. I don't know whether you still see a scar there, but this was 100 electrodes fired into my nervous system by a surgeon, and that linked my nervous system with the computer and onto the internet. So one of the experiments we did was I went to New York, and a hand rather like this one stayed in the UK, and my brain signals were sent across the internet to operate the robot hand on a different continent. So effectively, my body was not your regular human body, but my body consisted partly of a network, of the internet in this case. So you've got, if you're looking at healthcare, it's not just healthcare of the biological body, it's healthcare of the technology that's also then part of the body. With the hand, we actually had sensors on the fingertips, so I could feel how much force the robot, my third robot hand was applying on another continent, very, very accurately, could squeeze objects and so on. And it was a sort of force feedback. I could feel how much force the robot hand was applying. So it's the sort of thing that is useful, yes, for somebody that has lost a hand to repair, replace the hand, but it also changes what we mean by body. And I mean, to be honest, with that sort of thing, I could have this hand today with the same technology and connection. I could have a different hand tomorrow. The hand doesn't need to be attached to my body. It can be in a completely different place. It could be on a different continent, as was the case in the experiment. It could be on a different planet. So we're looking at the future where your body doesn't have to be where your brain is. Your body can be wherever the technology takes you. So healthcare, it expands. It's going to be a very different thing as to what we mean by healthcare in the future. Another part of that experiment, my wife, as you mentioned, had electrodes pushed in her nervous system, and we sent signals nervous system to nervous system. So we were communicating a whole new way. So healthcare for me and my wife now involves not just communication by this rather old-fashioned human way of communicating called speech, but also in terms of signaling directly from nervous system to nervous system, but ultimately brain to brain.
So if I recall from, whatever I've read about you, the first implant, it wasn't the brain gate, right? It was some RFID. So you've done so many implants, and we would like to hear from you, like, what's going to be the next implant you want to go for?
Now, the first implant was just an RFID. At the time, I think quite a few people have got it now, and identification. I think in hospitals, you get a lot of products are identified in RF signals now. But I think for safety purposes, it wouldn't be a bad idea if the human patients in the hospital were as well. So you're sure, the doctor is sure what patient they're dealing with. But for me, the next implant would have to be a brain gate or brain implant in the brain to link my brain with another brain, to actually do the thought communication experiment. But it is an extremely dangerous experiment, not from a biological or in terms of the operation. There are dangers associated with that, certainly. But if you think about it, it's a bit like a Jekyll and Hyde moment, because if I am in one place with an implant in my brain and there's somebody else in another place with an implant in their brain, when we switch the switch, we really don't know what's going to happen with the brains. How will they interact together? Will there be anything dangerous going on? Will one brain dominate the other? Will they, as I believe, they will start to communicate big time between each other. That's what brains do. Brain cells communicate. Brain neurons communicate. That's really all they do. And if you give them a new way of communicating, I think really they would go for it. But we don't know.
Yeah, that's true.
Got a scary thing.
Yeah, that's true. That's one kind of fear that you mentioned, and that's true. The other kind of fear could be, once you know how brain functions, maybe there'll be a time when we'll be able to duplicate or emulate the entire brain into a machine. And that'll be the point where we probably would touch this immortality. What do you think about this? It's all science fiction, but it might be true in times.
I think people have mentioned the possibility. For me, that is a lot more difficult. If we look at communicating brain to brain, that sort of thing, technically, I believe that's quite possible. Let's go and do it. We have the technology to do it. So, but if you look at copying in some way a human brain into a machine so that it is exactly the same, for me, that's very difficult. Is it impossible? I don't like to say anything's impossible. I mean, I think you could do it, but the problem is that 2 seconds later, the machine brain and the human brain would be very different because they've experienced, even if it's only for 2 seconds, they've experienced the world in a different way. So they might be identical at a specific point in time, but 2 seconds later, they would be slightly different because the machine brain would be sensing the world and experiencing the world in whatever sensory input, output. And everybody is a bit different. Every human, it's not like there is a human brain, it's all the same. Every human brain is a little bit different. And therefore, brain in your body, which is probably getting old and your senses are not so good and so on and so forth, would differ somewhat very quickly from the machine brain.
Okay, let me come back to the reality from fiction. We all talk about, these neural prosthetics.
If I can pick you up on that, I think research scientists, we are all sort of science fiction writers. This is what research is. What you do is you have a hypothesis. You feel, I believe that this is possible. I believed a few years ago that you could control a robot hand directly from your brain, from neural signals. And then we went and did it, proved the hypothesis was right, which is like, it's a mini science fiction. You're sort of saying a 1 year, 2 years ahead, we can do this. Sure. And technically, you prove it to be possible, or you get it wrong, and it's not possible. So in a way, I think for research, what we do, it's not that we say science fiction is silly or it's wrong. We are a little bit science fiction at that time when we feel this is possible, but we make science fiction into science fact. That's research, really.
Yeah, that reminds me of one of the comics that I read about Mandrake. It was 30 years back. I was reading these comics, and one person from Tram Traveler comes and asks, like, why don't your things in home, they talk to each other? And this thing is getting into reality these days. So the other question I had was around these neural prosthetics. Elon Musk has come up with Neuralink. Brian Johnson has come with Kernel. So what do you think? I mean, is it in response to this fear of AI or something? Do we have to be competent enough?
I think the fear of AI is one aspect. Clearly, if AI is really intelligent, if we're not talking about particular programs and things like that now, or a particular piece of hardware, we're talking about an artificial intelligence, something that is intelligent in roughly the same way that a human is, but it would be networked and have different powerful capabilities and so on and so forth. It potentially is extremely dangerous and may well have been initially developed for military purposes. So if we let it get out of hand, then it could act against us. So I think the whole idea of people like Elon Musk, and I dare to say myself in the same paragraph, but are looking to try and encapsulate that AI rather than have it acting against you, to merge with it, to become one with it and have the benefits, because artificial intelligence has enormous benefits in terms of the way human intelligence works. So if you can link the two together, then it opens up. I mean, one example, which is almost impossible for us to conceive at the present time. Computer systems, artificial intelligence operates generally in hundreds of dimensions. And we can take different pieces of information in and try and understand the world in a much more complex way in a computer. And a lot of scientists use computers for exactly that, dealing with hundreds of dimensions. The human brain works on 3 dimensions. We understand space as being 3-dimensional, which of course it's not. Space is space. Space is out there, and you can apply as many dimensions on it as you want. Hundreds give you a much, much more complex understanding of what's going on. Physicists deal with things like 10 and 11 dimensions. Fine. So if we link our human brain with an artificial intelligent brain, one example is that we would have, I hope, the ability to understand the universe around us in many more dimensions. That might completely change space travel. Instead of taking years and years to get to Mars and out to Neptune and Saturn and so on, we might be able to do it just like that. Really, Star Trek becomes a reality if we can link the human brain with AI.
True, and then for that we probably would have to live longer. Professor Kevin, once I read somewhere that you said that humans have limitations and limited capabilities. We need to enhance our sensory motor capabilities, and that is possible with the machines. What do you mean with that? Can you explain?
It is. Well, one of the things I did in the cyborg BrainGate experiment was to interact and understand the world in terms of ultrasonic signals. It's perhaps the obvious one. When you work in robotics, you use ultrasonics, which gives a sense of distance. Well, I was able to do that. On a baseball cap, I had ultrasonic sensors. I covered up my own eyes with a blindfold. And what I was getting were pulses of current, effectively, pulses of current into my brain that increased in frequency the closer an object came to me. Bing, 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 and bing, bing when it was further away and so on. There's something my brain, and I'm sure everybody's brain, would be quite capable of dealing with ultrasonic signals. Infrared, I think the same thing is not going to be difficult, but we just don't have ultrasonic and infrared signals and sensors attached to our body we at the moment. But we could have them, and all sorts. There was a film, I know, Ray Milland, The Man with X-Ray Eyes, I think. Fantastic film, science fiction. But I can't see why. It doesn't have to be X-ray eyes, but X-ray senses. Why can't we have X-ray senses? I think there's a whole range of things where we could sense the world in a much richer form than we do at the moment, and hence be able to understand not only the world, but understand each other much more, much less understanding between each other, as well as how we comprehend what's going on around us.
So I guess, I didn't receive any questions. So from audience, if you have questions, we're ready to accept these questions. But, it seems like the entire information about Professor Kevin is spread all over the internet. and so everyone gets to read it. And if there are no questions, we can move ahead. It's been really fortunate to have you here, Professor Kevin. I personally would like to continue, would like to be in touch with you later for my other projects. Only yesterday I've got a good news that I've got a big funding. So I've got a question here. Good. So the question here comes from someone who says that, when do you think the technologies are able to, I'm sorry, I missed it. So when do you think the technologies are able to replace human organs? I think we are very close to this.
I think with some organs we can do. I mean, let's just take a heart. I think artificial hearts now are not bad at all. And I'm not sure what the record for longest lived person, but I think it's well into the years. So I think for some organs, it's there now, but clearly for other organs like the liver, there's still some way to go. Just needs further research. I mean, there's a question, would it be possible to replace all our organs? Would it be possible to replace all of the body? And you have to say in years to come, why not? Why not? And you're just then, what is the human? If your whole body is replaced, ultimately, to take it in the limit, well, the human is the brain. Okay, the brain is within your body, within your sensory makeup, within the organs that you start off with. But then the body that you have, if it's taken away and you're given another body, which would be quite traumatic, I'm sure. But then, you are your own. So Vivek was talking about cancer and understanding cancer more. In a way, my own feeling is we should be researching much more in the area of artificial body parts and so on, because in a way, if we can do without, some people die of liver cancer, which is terrible. So if we didn't have a liver in the biological form, we had a technological one, potentially you could just replace it, like getting your car serviced. You go in, have a new liver today. Thank you very much. Way to go. So we don't have to worry about liver cancer at all. If someone gets liver cancer, give them an artificial liver. So I feel we should be perhaps doing much more research in that area than we do, and take some of there's enormous amounts of funding going to cancer. Perhaps they should go into this area. But we should also look at how do we keep the human brain alive? How do we keep it alive outside its biological body? Look just at keeping it functioning in now this new techno-biological body.
True. I guess the question should have been like, how do we, whether or not we would have some organs growing by themselves, kind of. So, but it's fine. We're coming to the end of the session. So, friends, I would give some concluding remark that the apparent effects of technology on healthcare are so far been very constructive, and will continue to be so as far as there are able people like Professor Kevin working with noble intentions, of course. Further, the technology and other required capabilities for a complete transformation in healthcare, and they exist, they're in place. There's always, however, a ripe and right time for such inductions, so which is expected to happen, of course, but gradually and accurately. So with these concluding remarks, I would like to end the session, thanking our eminent speakers, Mr. Wadhwa and Professor Kevin. Thank you very much. It was a thrilling and enlightening experience that we had today, and we would relish it for long. However, this wouldn't have been possible, of course, without the able team organizing this Nobel Fest, and their creativity and their hard work. It should be applauded as well. So thank you once again. Thank you all for attending and putting forth the interesting question. Thank you very much, Professor Kevin. I'd like to stay in touch with you. Thank you very much.
Bye-bye.